I'm Dr. Shane Conrad from Conrad Chiropractic and Wellness. Today we're going to discuss a little bit about our unique style of practice here at Conrad Chiropractic. Traditionally, chiropractic has been thought to focus on the spinal joints only, and it is a very effective form of care through spinal manipulative therapy, or what's normally called chiropractic adjustments. However, in certain practices, like ours, we tend to take a different approach to chiropractic care. Although we do, sort of as a foundation, still utilize the chiropractic adjustments to achieve normal range of motion and pain-free range of motion in the spine, we have a variety of adjunctive forms of care that we use in addition to that. Primary to those are muscle therapies. Now, it has been shown, and I've seen in clinical practice, in the utilization of muscles as a form of therapy, we tend to get better results in a shorter period of time than traditional spinal manipulation by its own. And that just makes sense when you kind of consider the difference between the two. Let's say, for example, I am a spinal joint or a spinal bone. I've got joints on either side, but I also have muscles on either side of those joints that control the movement. Those muscles would stick out somewhat like this, with me in the middle being the bone. Now, that's fine as long as those muscles are in proper tone and able to contract and relax properly. However, as often as is the case, one side will tend to be either tighter or stronger than the other side, creating a sort of displacement in some cases, or in its inability to relax, can restrict the opposite muscle from actually moving the joints in the opposite direction. Now, chiropractors traditionally use adjustments very well to restore a misaligned bone to normal alignment, or one that's not moving to a greater degree of range of motion in that area. However, if we don't address the muscular component, over time, that tight muscle is just going to tighten up again and pull things right back to where they were. Now, on the other end, were we to then look at this muscle and treat it directly, when we realign and restore natural motion, that muscle isn't going to have the same tendency to then pull things back out of alignment. Long term, then, if we restore as well proper tone and balance between the left and the right muscles, then we can see a full and complete form of recovery that's going to keep you in better alignment, not just a couple of days after an adjustment, but for weeks, months, and sometimes many months after a single adjustment and working on those muscles. Now, today what you're going to see is we're going to go through a standard in-office treatment at this office, including our spinal adjustments, also included in that some extremity adjustments, which you sometimes don't see at traditional chiropractic offices. And then, of course, the big difference between us and a lot of other offices is our integration of the muscle techniques. And we're going to demonstrate today some of those techniques and how they would be applied to a specific patient. It may be a little bit different to your particular injury. However, we can take the same kind of concepts and move them around to different spots and focus on what may be your injured area. Thanks, and we'll see you then.